welcome back to the channel. My name's Dr. James Gill and you'll join me for another clinical skills adjacent video. Today we're going to be looking at the background of how to use an ultrasound scanner, crucially in terms of the vocabulary that we're going to use with regard to the planes of the body. Now there are three planes that we need to be aware of. We've got the coronal plane, we have the sagittal plane and the transverse plane. Now there is also a fourth angle or view with which you can scan, that being the oblique angle, which we'll talk more about later, but for the time being we're going to stick with the main three. So what are these views of the body? Well, these are ways of viewing anatomically the patient, and so that we can make sure that we are discussing what we're seeing correctly. So in terms of that, the patient is always viewed standing in the anatomical position. So looking forward with their palms facing forward and their thumbs facing out. In this position, we then want to start off by thinking about a coronal view. So corona, from crown, i.e. going ear to ear, or perhaps a different way of viewing it, is slicing from the front to the back. This is the easiest image to interpret because essentially it looks like a person. You've got a front slice right the way through. In terms of doing this, this is one of the longitudinal views because we're looking lengthways at the patient. The next that we need to discuss is the sagittal view. So this comes from the word Sagittarius, and one way of thinking about it is that you can shoot an arrow through the heart. That gives you an idea of how you're looking at the patient in slices from left to right. So Sagittarius slicing is the way I've always kept that in my head. And in terms of this, again, longitudinal view, most students can orientate themselves relatively easily because, again, you can see the spine, the ribs. You can get an orientation without too much difficulty. Now that brings us to the third plane we have, the transverse view. This is slicing the patient horizontally. It's not a longitudinal view as a result. This is often difficult for people to get their heads around in the first place because we don't view our world in this transsectional form. Essentially it's like cutting across the sausage and looking at what it's made from in that transverse view, and that's particularly challenging for a lot of people. As I said, there is an additional view, although not a plane. That's a oblique view, and that's anything that's coming in from the side at an angle which is not a multiple of 90 degrees, but we're really not going to worry about that for the moment. That's more to do with trying to view specific things rather than viewing the whole patient. Now, I've always found that I'm a very visual learner, so let's take that intellectual knowledge to some pairs and we'll see how we get on with that, actually showing you the coronal views, the sagittal views and the transverse views. Come with me. So let's use a pair just to start this off, with the head being corresponding to the stem, the feet corresponding to the base of the pair. If we're scanning from the left of the patient to the right of the patient, we're going to be doing a longitudinal scan and we're going to be scanning in the sagittal plane. Sagittal for sideways, we're getting from the right to the left of the patient. If we're going to be scanning in the vertical from the anterior to the posterior, there we're going to be scanning coronally. And finally, if we're scanning transverse, we're going to scan from the feet, moving upwards towards the head. In all of those orientations, we need to be aware of where the nub is because that will correspond to the right side of the screen, and some of our orientations may change. In a transverse view, the right side of the ultrasound probe, the right side of the screen, will correspond with the left side of the patient. In a sagittal view, the nub will correspond to the head of the patient, the top of the probe will correspond with the right side of the patient, and the bottom of the probe will correspond to the left side of the patient. Finally, for a coronal view, again, we would have to turn over so the nub corresponds to the head of the patient. Then the bottom of the probe, which is now on the top, will correspond with the top of the patient, the anterior, and the top of the image, the bottom of the probe in this orientation will correspond with the posterior of the patient. So we've got an orientation flip in terms of coronal scanning as well. So let's have a look at that with regard to slices. If I'm holding the probe in a transverse fashion, so I'm going across the pear, then we're going to see an image as if we have gone transversely. So we're getting that cut right through the patient, the pear, and hence why this can be slightly problematic for some people to interpret. So we're not used to looking at the patient in this transverse orientation. It's a horizontal view and it's quite easy to spot because it's very different from any other ways that we even conceive of how to look at patients. We've very much got this cross-section, but that is slightly more difficult to interpret as a result because of orientating our mind with this transverse view. Then if we want to try and scan in the coronal plane, this particular aspect is slicing the patient through from the front, and that's similarly what we're going to be seeing as we go down the patient. Essentially, this is our gingerbread man view. It's what you'd see with a standard chest x-ray. So when it comes to scanning in the coronal plane, we actually want to rotate the ultrasound machine round so that the nub is pointing toward the patient head, at which point we're going to scan from the anterior to the posterior. That will then mean that the top of the screen corresponds with the posterior of the patient and the bottom of the screen corresponds to the anterior, and this will allow us to get another longitudinal plane view, the same as we'll have on the sagittal view. Speaking of which, so keeping the head at one end, the sagittal view is again another longitudinal plane, but this time in the left to right orientation. So we're looking to be able to see the left and the right hand sides of the patients. And in this particular aspect, we're going to again have the probe nub directed towards the patient head, and we're going to scan from the right through to the left of the patient. The nub will correspond to the head of the patient. The top of the screen will correspond with the right side of the patient, and the bottom of the screen will correspond to the left side of the patient. And we're going to scan going one way across. As mentioned, an alternative way of scanning the patient is going to be an oblique view. Realistically, that's a chaotic view in my opinion. It's just scanning across the patient at anything less than 90 degrees or not a multiple of 90 degrees. A final form of scanning is going to be the oblique view. This is not one of the three main planes, but is again a way of imaging parts of the patient. Crucially, it is any angle that is not either 90 degrees or a multiple of 90 degrees. So realistically with that, we could consider it to be slightly a chaotic viewpoint. Realistically, it's any angle that you like. top tip, don't eat your pears in an oblique view. Yeah, I've got a lot of pips there. Okay, so hopefully that set out how we want to keep the images of our patient in our head, but crucially how the probe orientation changes in order to allow us to see what's going on in the screen in the correct orientation. And it all is focused with regard to the position of the nub to give us the right side of the screen, and the top and bottom of the probe to give us the anterior posterior or caudal cranial views. We need to keep in mind how we change the orientation of the probe for the scanning, and as long as we keep that in mind, it should allow us relatively easily to interpret what's going on the screen in terms of position within the body. Now, I want to be very clear that that's not saying that if you know your planes, it's easy to tell what's going on with the ultrasound. What I am saying is it should allow you to determine what's up, what's down, and what's left and what's right. And that's going to be particularly important for how you're going to use a scanner with regard to, for example, nerve blocks, which we'll be talking about in the next video. So hopefully this has been useful for yourself. If there's more that we can do to help you with regard to things such as this, the anatomical planes, please drop a comment in the box down below and we'll see what we can do to help. I'll see you in the next one. Cheerio.